Okay, we'll go ahead and get started. Lots of questions. Where to start? We have had several questions asking, this is regarding plagioccephaly, about cranial and is it effective? What's your take?
That's what I use.
Yes.
I have never had a patient find craniosacral therapy truly effective in correcting their plagiocephaly. To me, from just a pure physiologic standing, it doesn't make much sense. If it would, I think we'd probably get a lot more success, and like there wouldn't be a need for helmets if that was a true, effective, consistent treatment. So I don't recommend craniosacral for treating plagiocephaly.
Dr. Moen, someone's asking for more of an explanation of scoliosis in overweight adolescents. Do they have a higher incidence of scoliosis or just a bigger curve when they're finally diagnosed?
So we don't think that they have a larger incidence of scoliosis. It is just that it is more difficult to see and more difficult to measure, and so it's more likely to be missed. And so in that population where it's harder to see, they may be more skeletally mature, an earlier bloomer based on their, obviously, that they are just more likely to present at a time when their curve has already had a chance to get more meaningfully developed and is a larger curve at that time.
Several questions about what to tell the parent whose baby, quote, hates tummy time.
Oh, yes. Oh gosh, that's always very challenging. When I start with my patients, because I have a lot of patients that hate tummy time, I usually say, well, let's start small. And I love using, again, that, like, let's roll them in. Let's do, I'll say I'll take 10 seconds of tummy time versus no tummy time. So we're going to start small. I'm building a contract with that baby. We're going to roll over. We're going to do a little bit of tummy time. Once I feel like they're getting, and parents are getting to that point where it's like we're melting, then we're going to roll on our side and try to calm down and kind of take a break. Let's catch our breath. And kind of just introducing being familiar being in that position instead of working on total time. First we got to be okay being there before we can increase our total time. So starting small and increasing our frequency of attempts. I know a lot of parents are like, they hate it and then they're fussy and like by the end of the day, I just don't even want to try. So I'm like, when are they happy? And they're like, usually around 10 a.m. I'm like, then that's when we're going to work on it. Our goal being that we're doing it all day long, but let's start in that happier window. So I'd say starting in a happy window and start for really short bouts with the goal not being total time, just being there.
Yeah, there's a question about parents being told they can't do tummy time until the cord falls off. And I've gotten that too in my office from the hospital staff.
I don't know where that's coming from. Please do tummy time as soon as possible. I mean, there's a reason that when babies are born, they're placed on mama's chest. And so let's encourage that as much as frequently as possible. I think most babies that hate tummy time is because they didn't start it until they're 1 to 2 months later. And so, I mean, I don't enjoy exercise when I've taken my 1 to 2 months off.
No, I don't ever like to exercise. Dr. Moen, this is a good question. What is the relationship between leg length inequality and scoliosis?
So I think so there are folks who have a leg length inequality, which you can measure by when they're standing. You might feel that their pelvis is asymmetric. And now again, if somebody does have a curvature in their spine and their flank is asymmetric, it may look as though their pelvis is asymmetric as well. And sometimes both can be occurring. But we would expect that if you had a meaningful leg length difference, you would have an apparent scoliosis. So it would look like you had a curve in your spine, but it was relative to the leg lengths being different. And so
Hey guys, thanks for watching. To continue, please log in or create an account for free. Thank you for your support.